Welcome to the online new employee benefits orientation. In the following videos, we'll cover the many great benefits available to you as a member of Sumner County Board of Education. In this presentation, we will talk about benefit eligibility rules for you as the employee, eligible dependents, and the effective date of your coverage will also be explained. We will also review the deadlines and the required documentation. The Sumner County Board of Education is committed to offering a comprehensive, competitive, and affordable benefits package. We want to help you and your family enjoy the best possible health and well-being. We want to provide you with meaningful options so that you have the flexibility to make choices that best meet your needs. And we want to make helpful tools available so you can make informed decisions and have greater cost transparency. Your benefit choices are detailed in your Sumner County Board of Education Benefits Guide, found at sumnerschools.org/benefits. All videos can be found under the New Hire tab, as well as other helpful information. We encourage you to review our website for additional details as we update often. To be eligible to enroll in insurance coverage, you must meet specific criteria. If you are unclear if you meet the eligibility criteria, please contact the Benefits Department. Full-time employees are benefit eligible the first of the month following 30 days from your effective date of hire. For example, if you started your position July 27th, you are benefit eligible September 1st. If you are unsure of your effective hire date or when you began your full-time position, please contact the Human Resource Department at 615-451-5200. In the event you take advantage of the benefits that are available and you wish to enroll any dependents, supporting documentation of the dependent relationship is required. Supporting documents would include copies of your marriage certificate, birth certificates of dependent children, and Social Security cards of all dependents. Please forward copies of these documents to the Benefit Department at the time of your enrollment. For a complete list of eligible dependents and supporting documents, please refer to the Benefits Guide found at sumnerschools.org/benefits. Our Sumner County Board of Education Benefits Portal is available to help you gain a better understanding of your benefit choices. We encourage you to utilize this resource, along with contacting our Employee Benefits Assistance Office at 855-804-6303, where you can gather other valuable information. Before we get started, please note you can only make benefit election or coverage changes during specific periods. They include your initial period of eligibility. As a new employee, you have an initial enrollment period of 30 days from your date of hire to elect benefits. If you waive benefits when initially eligible, you'll have another opportunity to select coverage during annual open enrollment. Our annual open enrollment is generally in the fall, with changes effective January 1st. Also, during the plan year, you may enroll or make benefit changes during the year if you experience a special qualifying event. A special qualifying event change allows employees to make certain mid-year benefit changes consistent with the qualifying event, such as a marriage, divorce, birth, or change of employment status, just to name a few. Employees have 31 days from the date of the special qualifying event to make related changes to their benefits. You will need to complete the appropriate forms and provide a copy of supporting documents for the elections or changes to be made. To complete this change or confirm the effective date, please contact the Benefits Department at benefits@sumnerschools.org. Now let's move on to the rest of our presentation. In this presentation, we will talk about the process for enrolling in Sumner County Board of Education benefits. When the Benefits Department receives the new hire notification from the Human Resource Department, we will input your information into the benefits system. Upon completion, the system will generate an email sent to the email address you gave Human Resources during the hiring process. The subject line will be sent from Sumner County Benefit Department, and the email will be from mailer@infinityhr.com. If you have not received a benefits email within 2 weeks from your hire date, please email the Benefits Department at benefits@sumnerschools.org. Also, please check your spam or junk folder as the email sometimes goes outside of your inbox. Once you receive the email, please follow the steps listed in your Sumner County Board of Education Benefits Guide to create an account at infinityhr.com and begin the process. After you've made the decision to either enroll or waive benefits, please make sure you save and confirm your elections and print the confirmation benefits summary page. If you do not save and confirm, all benefits will be waived by default. Also, please note your benefits portal will close 30 days following receipt of the benefits email. Please remember, you are benefit eligible the first of the month following 30 days from your effective date of hire. For example, if you started your position July 27th, you are benefit eligible September 1st. You have 30 days from your hire date to make your elections or waive benefits. As a reminder, always check your pay stub each month to ensure the correct elections are being deducted. If you have any payroll questions or concerns, please contact payroll@sumnerschools.org. So let's recap a few things. When are you benefit eligible? First of the month following 30 days of employment. When do you need to make your elections? 30 days beginning from your effective date of hire. And what happens if you do nothing? All benefits will be waived by default, and your next opportunity will be open enrollment or if you experience a special qualifying event. We want to make every effort to ensure all employees of Sumner County Board of Education are receiving our emails and texts, as our benefits team sends out important information relating to benefits and wellness requirements and opportunities. If you do not receive any emails from Central Office or Benefits Department, please contact Technology Help Desk at 615-451-6513 or extension 77704. Or you can email us at benefits@sumnerschools.org to be added to the Everyone grouping. If you wish to receive text messages, please call our Employee Benefits Assistance Office at 855-804-6303. While we hope you'll accept the text messages, you'll have an opportunity to opt out of receiving them if you desire by typing stop to any text. Please do not hesitate to contact us with any questions or concerns at 615-451-5214 or benefits@sumnerschools.org.
Welcome to your Sumner County Schools Benefits website. We're going to take a few minutes to provide an overview of the website and important information. As we start at the top of the homepage, you will see a slider that has various relevant topics that could change throughout the year. There'll be different bubbles here that go over different topics. Next in the middle is the enroll or change in benefits that takes you to Infinity HR, our online enrollment tool, where you can enroll or change in benefits. Next is our assistance team through Employee Benefit Assistance. You can call them or visit that information to get more information on how to enroll, how to answer simple questions, or even claim issues that you might have. And finally, on the far right is the Pocket Pal app. This is a smartphone-enabled application for either Apple or Android operating systems. And you can click here to learn how to download that application and have this same information available at your fingertips. As we go to the left, we're going to click on New Hires First. This will take you to a number of important videos where we break down the individual benefits with Sumner County Schools. Everything from how to enroll, an overview of the website, your medical plans, so on and so forth. Next is important information. Again, this will change year over year, but this is the most relevant information that you will want to take a look at in terms of what you need to do and due dates that are relevant to the particular plan year. Next is the benefit guides. We'll have both benefit guides for active employees and retirees. And again, this will be updated each year. Next is the Sumner Health Clinics. An overview of the clinics is provided in the middle. and then helpful information to the right on how to book an appointment, online scheduling, hours of operation, or the telephone number. Next is the telehealth program that's offered by Sumner Health. Again, just an overview of the program where you can click to learn how to use those particular services. We then have a video on Network S versus Network P, and also the Wellness Promise. Again, this is the current plan year's information. This will change each year, and we'll make sure that the year is clearly identified and you have all the important due dates and information that is responsible. You can even click on each of the individual needs to talk about important due dates and where you need to go. How to change and enroll your benefits is what we just talked about at the very beginning on the homepage, but you can get to it from here as well. The instructions, the link right to Infinity HR, and how special qualifying events are handled. The next two sections have some plus signs here. As you click on this, this is for your active employees and this is for retirees. For your active employees, you have an individual page for each benefit. We'll click on health benefits just for the example today. This will provide you both of your medical plans. This is the PPO plan and everything associated with it. This is the CDHP. You'll have a general overview of the plan, any kind of relevant plan documents with the certificate of coverage or the benefit summary, the resources with the policy number and telephone and website. And then again, you can click this and it will go to the PPO plan. Each page will follow a similar pattern and have that available to you. The next thing we'll do is look at retiree benefits. It's designed just a little bit differently. Your retirement packet is there, which we're bringing up, information, what you can do, links to important forms, and then commonly requested retirement forms, and then all the individual benefits that are relevant for retirees. Next is Healthcare Bluebook, which is our advocacy and price transparency tool to find out what is the best price for a particular service. This is a quick video on what to expect, how it works, and then how to contact Healthcare Bluebook over to the right. Different employee discount programs are offered. These are a few of those that are offered today. And then lastly, information about COBRA, if those benefits apply to you. And then resources is the last piece on who are your vendors and partners and how you get in touch with them via web, email, or phone. And then lastly, if you need any help, again, this goes back to our employee benefit assistance team, just like it did on the homepage, and you can either email us or call the phone number. So I hope you found this video helpful and hope you have a great day. Take care.
Let's review our medical benefits with Blue Cross Blue Shield of Tennessee. There are 4 decisions to make when choosing which plan is best for you and your family. Decision 1, which type of plan? The PPO or consumer-driven health plan? Let's look at the differences between the two. A consumer-driven health plan, also known as a CDHP, has lower premiums, slightly higher deductibles, higher out-of-pocket maximum, but it is also eligible for a health savings account, a special bank account for this particular program. The PPO plan has higher premiums. You would pay less for copays such as office visits and pharmacy. You would pay less in coinsurance and have lower out-of-pocket maxes. Regardless of which plan you choose, both have preventive care benefits covered at 100% so long as you use an in-network provider. Each option has different out-of-pocket max costs for copays, for example, specialist visits versus primary care visits, deductibles such as employee only versus employee plus spouse, coinsurance, and out-of-pocket maximum. Next, let's look at the advantages of enrolling in a CDHP plan. As we talked about before, you're eligible for a special bank account called a health savings account, or HSA. Let's review the bullet points. This is owned by you and funded with pre-tax dollars to pay for medical, dental, and vision expenses not covered by insurance. The money can be rolled over from year to year. All of the money belongs to you with no use it or lose it rule. The money also remains in your account until you spend it. It's portable, meaning you always maintain the benefit. You can change your contribution anytime during the year. Distributions for qualified medical expenses are tax-free. All new HSA enrollees will be required to log into their account and accept the account agreements in order to complete the opening of their accounts. And for individuals that enroll after January 1st, the board contribution will be prorated. This program includes a generous board contribution of $500 annually for individual coverage and $1,000 annually for family. And lastly, there are annual IRS maximum contribution limits, which can be found in the benefits guide. Let's look at decision 2. Should you enroll in the wellness or standard plan? If you enroll in the wellness plan, you and your spouse, if they are covered, must complete the wellness promise. The wellness promise includes the following. You complete a physical at a Sumner Health clinic or through your personal physician's office. Then those results are submitted to Sumner Health. Next, if you have biometric results that are identified as at risk, you must complete health coaching. The physical form can be found on our benefits website. Also, specific due dates for each of the above requirements can be found on our benefits website. Decision 3, which coverage type? Employee only, employee plus spouse, employee plus child, or family. Choose which coverage is best for you. And lastly, let's talk about the networks. Blue Cross Blue Shield has 2 networks, Network S and Network P. Let's look at the differences. On our benefits website, you will find an easy to understand video about the differences between Network S and Network P. At a high level, Network S is a smaller network. It is lower in cost, but does not include the TriStar facilities. Network P is a larger network, slightly higher in cost, and has additional hospitals and facilities not offered in Network S.
Let's look at the differences between Network S and Network P. How do I decide which network is best? With Network S, the premiums are lower. However, the benefits are the same: deductibles, co-payments, and covered services. Primary care doctors are also the same: family practice, pediatricians, internal medicine, and most of the specialists are the same. How do you determine which network your providers are in? First, go to bcbst.com and click on Find Care, or call Employee Benefit Assistance at 855-804-6303. Next, how do you determine which hospitals are in Network S? In the green, or those that are covered in Network S, you will find Vanderbilt Children's Hospital, Vanderbilt Medical Center, Sumner Regional Medical Center, and Metropolitan General. Outside of Network S is Hendersonville Medical Center, Centennial Medical Center, and Skyline Medical Center. What's different about Network S? S is for savings. The doctors in Network S have proven high-quality patient care and have agreed to better negotiated pricing, which on average will save 10% on medical bills. And finally, what happens if I go out of state? Outside of Tennessee, we use the Blue Card PPO network. It has pharmacies, doctors, and hospitals all over the country.
Let's talk about Healthcare Bluebook. This is a price transparency tool designed to help our employees stretch their dollars further. Our healthcare system is complicated, and it's difficult to know which doctors or facilities we should go to for any particular service. How good are they? How much is it going to cost? This is where Healthcare Bluebook comes in. It's an added benefit to our health plan to help you shop for care, compare facilities, and ultimately save money. Costs for services, such as an MRI, can be substantially different, varying from 100 to 500% more depending on which facility you choose. There are also financial rewards built into the program, so when you utilize the most efficient providers, you can receive a check in the mail. Let's take a minute to go to our benefits website and look at Healthcare Bluebook. As you navigate to our website, you will come down to Healthcare Bluebook, and this is the landing page for Healthcare Bluebook. Here is a brief video that explains an overview of the program. Also, you will see that the number for Healthcare Bluebook is here, and it will allow you to go right to the Healthcare Bluebook website. We'll show you that in just a second. Also, this program can be downloaded to an Apple or Android device, and the code for Sumner County Schools to enter on that device is SCBOE. We'll also find that on one of the brochures. Over to the right, we will look at 3 different sections I want to draw your attention to. The first is an FAQ. The FAQ explains what Healthcare Bluebook is, how you define fair price, and also goes through their color coding system. Green means at or below fair price and highest quality. Yellow means slightly above fair price, average quality, and red means it's the highest price and lowest quality. There are also information about quality rankings, how you'll receive rewards, so on and so forth. Next, as we go back to the website, we'll show you how to click on the Healthcare Bluebook website. The website can be found here. You simply need to be enrolled in the medical plan, type in your last name and the last 4 digits of your Social Security number. And lastly, from the website, we'll pull open the doctor search flyer, which is found here. This again goes over how you are looking for particular doctors and how you might be overpaying for healthcare services, reinforces the color system of green, yellow, and red, and also at the bottom shows you how to download the application and the company code.
Sumner County Board of Education has partnered with One-to-One Health to provide its employees and their dependents who are enrolled in the healthcare plan access to the Sumner Health Clinics at no additional cost. Some of the services that are offered at these clinics include walk-in clinic hours for sick visits only, annual flu vaccines, annual health assessments, various vaccinations, physicals, acute visits, maintenance medication refills, as well as on-site medication dispensing. For your convenience, these clinics are located throughout Sumner County. For more details on the clinic locations, walk-in hours, and regular hours of operations, you can visit sumnercountyhealth.com. You can create an individual account by calling 855-571-4500 or pre-register on the patient portal at www.sumnercountyhealth.com. Once your individual account is created, you can use the Helo app or the patient portal to book an appointment, review lab results, or review any progress notes that may have been entered by your provider. But remember, you can always schedule an appointment by calling 855-571-4500. All newly hired full-time employees and their spouses who wish to enroll in the wellness plan are required to complete a physical at a Sumner Health Clinic or through their personal physician's office. Please refer to your benefits packet for deadline information. Results must be uploaded in your wellness portal by the deadline. Members whose biometric results are identified as at risk in one or more areas must complete health coaching with a one-to-one health coach by the assigned deadline. You have a dedicated wellness portal to assist you and your spouse with completing these wellness requirements. You can create an account at sumnerboe.wellright.com to get started. For assistance, you may reach a Sumner Health Wellness team member directly at 615-657-4930. Your benefits department will send out important updates and annual wellness plan information via email, so be sure to check your email to stay informed. The One-to-One Health Wellness Center is located at Ellis Middle School at 102 Indian Lake Road, Hendersonville, Tennessee. A few additional services provided by Sumner County Board of Education and One-to-One Health include our behavioral health services and our telehealth services. Behavioral health offers a full range of mental health services provided either virtually or in person by licensed counselors and board-certified psychiatric mental health nurse practitioners. You may use telehealth for well or sick visits, and our telehealth providers are able to diagnose and treat most health-related concerns at the convenience of your home. Fitness and nutrition classes are also available to Sumner County Board of Education employees who are enrolled in the healthcare plan. For more details, to include dates and times of these classes, you may visit www.sumnercountyhealth.com.
Let's review our life insurance benefits through One America. There are two types of insurance that we offer. The first is basic term life insurance and AD&D. After 3 years of continuous service, Sumner County Board of Education provides a basic term life and AD&D policy for 1 times your annual salary, up to $200,000 at no cost to you. Basic term life insurance offers financial protection in the event of a premature death. The AD&D portion, or also known as accidental death and dismemberment, pays a benefit if your death is the result of an accident. If you suffer an injury such as the loss of a limb or an eye, you will receive a portion of your AD&D benefit. The other type of benefit that we offer is voluntary term life. Same type of policy, but this is 100% employee paid. It allows you to individually select an appropriate amount of life insurance for you and your family. Coverage is available at low group rates. The premium has guaranteed coverage, and your levels will vary by whether you're a spouse or an employee, also based on how much you can get based on your salary. And then your cost also would be higher or lower based on nicotine use. If you want to get an estimate of your monthly cost, it will be based on your individual age and those situations we discussed, and you can find that on your online enrollment system. We highly encourage you to make sure that you have the right level of financial security for you and your family. Let's review our short-term and long-term income protection benefits with One America. What is disability insurance? Well, it's also known as income protection. It replaces a percentage of your income to help pay for those bills, such as rent or your mortgage, the gas or electric bill, should you become sick or injured and unable to work. And there are two types, short-term and long-term. Let's review both. We offer two types of benefits at Sumner County Schools. They are both voluntary benefits, meaning it's 100% employee paid. That is until you reach 3 years of continuous service, where the board then will start paying for your long-term disability insurance, a fantastic benefit. Let's first review short-term disability. It is intended to protect your income, as we said before, in a short-term duration for up to 11 weeks in the event that you're injured or ill. It pays 60% of your weekly salary, up to $1,385 per week. Important, this is a weekly benefit. If for whatever reason you continue to be disabled, then long-term disability kicks in. This is intended for longer durations where the benefit starts at the 12th week of disability and continues until your Social Security normal retirement age. It again pays 60%, but it's your monthly salary, up to a $6,000 per month benefit. So again, short-term disability is a short-term duration of 11 weeks, long-term, a longer duration. Short-term is a weekly benefit, long-term disability is a monthly benefit. These are both individual selections. You can enroll in one or the other, or both. Highly recommend that you consider both. Your actual cost is based on your individual salary, and you can find that exact cost for each product through our online enrollment system. Let's talk about our dental and vision benefits. Our dental benefits are with MetLife, and we offer two options, the standard plan and enhanced plan. If we look at the right, our standard plan has lower premiums with a $750 per year annual maximum benefit and covers services such as preventive care with cleanings, exams, x-rays as an example, and basic services, fillings, simple extractions, and just covers those two services. If you want enhanced benefits, that would slightly be a higher premium. It would double the maximum benefit to $1,500 a year. It would also include preventive and basic services, but also would include major and orthodontia services as well. Major services include crowns, bridges, dentures, oral surgery, and endodontics as an example, and also orthodontia services for children only. What's important to note about MetLife's plan is when you go to your provider, there's no need for an ID card. Simply have your provider look you up in the MetLife system. It's real time, and they can verify your benefits right there in the office. Next, let's talk about our vision benefits through IMED. Same as dental, there's 2 plans. The covered benefits for both plans are going to be the same. It will cover exams, frames, lenses, lens options such as UV or tinting, polarization, things of that nature, contact lenses, and even laser vision discounts. The differences come between the 2 plans on the level of premiums and allowances, and also the frequency. The standard plan has the lowest premiums, has a slightly lower allowance for each of those services listed above, and has a 12-month frequency, meaning every 12 months you can get an exam, lenses, or contacts. If you were to need frames, those can be done every 2 years. Our enhanced plan is slightly higher in premiums. There's a larger allowance, meaning you pay less, the insurance pays more, and everything has a 12-month frequency. So if you need frames more than every 2 years, perhaps the enhanced plan would be a better fit. And also, just like the dental insurance, no ID card is required. So when at your ophthalmologist or optometrist, simply have them log into IMED system through their computer. They can verify your benefits then. Thanks so much. Let's review our flexible spending account benefits through consolidated admin services. What is an FSA? It is a tax-advantaged bank account to help you decrease your taxable income and increase your take-home pay. There are 2 types of accounts. The first is a healthcare FSA. This is used for eligible out-of-pocket expenses for medical, dental, and vision care expenses for yourself and your eligible dependents. Examples include the amount you paid towards your deductible, copay, such as doctor visits and prescriptions, braces, glasses, contact lenses, etc. A full listing can be found on our benefits website. You will also receive a debit card to pay for those eligible expenses. Simply swipe the card and hold on to your receipts. You cannot enroll in the FSA if you're enrolled in a consumer-driven health plan. You would use the HSA account for the CDHP plan. If you enroll in the PPO plan, that is when you would use the FSA. The FSA does have a use it or lose it rule, with one exception, that you do have a 2.5-month grace period at the end of the year. The second type of account is the dependent care FSA. This is used to pay for eligible expenses for the care of a dependent child under the age of 13 or a dependent adult. Qualifying expenses include things such as preschool, before or after school programs, child or elder daycare. If you are enrolled in both the healthcare and dependent care FSA accounts, you will receive 1 smart card. And lastly, the IRS sets annual contribution limits, which can be found in the benefits guide.
The Sumner County Board of Education provides all employees and dependents support through our Employee Assistance Program at www.guidanceresource.com. It is a great program that provides support, resource, and information for personal and work-life issues to assist you and your family. The EAP aids with personal issues, planning for life events, or simply managing daily life, work, health, and family during a difficult time. This program is company-sponsored, completely confidential, and provided at no charge to you and your dependents. Please visit sumnerschools.org/benefits to learn more.
Let's review our critical illness benefits through MetLife. What is a critical illness? It's designed to help employees offset the financial effects of a catastrophic illness through a lump sum benefit if you're diagnosed with a covered critical illness, such as heart attack, stroke, or cancer. The individual cost is based on your situation and can be found on our online enrollment portal. Let's look at how coverage amounts work. If you're an employee, you can elect between $5,000 and $50,000, all on a guaranteed issue basis, essentially meaning no medical questions. Your spouse or child from birth to age 26 can also elect coverage of 50% of whatever benefit you elect as an employee. That's our critical illness benefits. Please take a look and see if this insurance benefit is best for you and your family.
This is a brief overview of the Tennessee Consolidated Retirement System and VALIC AIG supplemental retirement plans. All full-time employees are automatically enrolled in the Tennessee Consolidated Retirement System plan. TCRS provides a lifetime monthly benefit at retirement once eligibility has been met. Employees become vested with TCRS at 5 years or 60 months of creditable service. In addition to the TCRS plan, the Board of Education offers a robust supplemental retirement plan. A few highlights of the plan include both pre- and post-tax dollars can be contributed to a 403B and/or a 457B plan. Loans and hardship withdrawals from the plan are available. Contribution amounts can be increased and decreased at any time throughout the year. Access to your account is available online and statements will be mailed to your home address. Rollovers from other retirement accounts are allowed. The plan also offers personal one-on-one assistance and financial help through asset allocation, college planning, investment planning, life insurance, mutual funds, retirement planning, and wealth accumulation. Please note that the Board of Education supplemental retirement plans are voluntary. The Board of Education does not match any contributions to these plans. For additional information and enrollment assistance, please contact VALIC AIG at 800-448-2542 or Arista at 855-804-6303 or email Sumner tpa@aristacg.com. For information and assistance concerning TCRS, please contact 800-922-7772. On behalf of the Benefits Department, welcome to the Sumner County Board of Education. If you have any questions or need assistance, please feel free to contact us at 615-451-5214 or email benefits@sumnerschools.org.